Good evening, students, parents, and friends. I'm Kasha Godleski, representing the Office of Alumni and Parent Engagement at Lemoyne College. Welcome and thank you all for joining us this evening for a virtual town hall on the reopening for the spring 2021 semester. Just a few quick introductions and I'll turn it over to my colleagues. To start off, Ann Carney, the Interim Associate Provost for Student Development, will share a few words. She will then moderate our panel, which includes Kathy Adams, Nurse Manager of the Wellness Center, Ann Bersani, Associate Director for Campus Life and Leadership and our Title IX Coordinator for Student Development, Mary Shad, who's the Interim Director of the Student Success Center, Mark Godleski, Assistant Dean for Student Development, John Haley, Director of Campus Life and Leadership, Scott Peterson, Public Health Response Coordinator and from the Lemoyne COVID Office, Jim Seriano, the General Manager for Sodexo, and Jen Tebin, Physician Assistant in the Wellness Center and the Public Health Response Coordinator in the COVID Office. Over the next 45 minutes or so, each panelist will share an update and important information from their area in which they represent. From COVID testing to student activities, we'll cover a lot of ground. If you have questions along the way, please submit them using the Q&A function that can be found at the bottom of your screen. Our panelists may be able to answer them online, or we will get to them at the end of the presentations. If at the end you still have questions, we encourage you to visit the COVID information page that can be found on the Lemoyne's homepage at www.lemoyne.edu. And you can also email the COVID office at coronavirus@lemoyne.edu. From here, I'll turn it over to Ann Carney. Ann?
Okay, good evening, everybody. I wish I could see all your faces. And to our students out there, we just want to say on behalf of the whole team here, we have missed you. It seems like such a long time, and we are so ready to have you back. It's just too quiet up here on the Heights, and we're ready. We're ready to embrace you, and we're ready to move forward in a semester that is still unprecedented. We still have lots of challenges ahead, but there's lots of reasons to be hopeful. And I really hope that tonight's session is helpful for you in terms of just information. We want to make sure that you have time for your questions. The staff will be answering things in the chat, as well as we're saving time at the end. So besides missing you, I want to tell you that we heard you. The student government, in conjunction with my office, there was a survey put out. Hopefully many of you responded. We had over 930 students respond to the survey, and we asked some pretty important questions about how did your semester go. And one of the things that was really hard for us to hear was how many of you felt lonely, and how many of you felt so isolated. And as much as we could understand that, it bothered us, and we all said collectively we have to do better. The other thing was stress. Over 75% of you said that you always or most often felt stressed, and we can totally relate to that. So again, this semester, besides the physical health and the COVID and the safety around that, which is as important as ever, we're really going to focus on your well-being and your mental health. And the best way we know how to do that is to create activities and programming that is fun. And FUN is the word this semester. We're going to get you guys outside with all kinds of activities. John Haley is going to wrap us up tonight with sharing with you with some really very exciting activities. But I just want to tell you guys, make sure you bring your hats, your gloves, your mittens, and your ice skates. There's a little hint there. So you're going to hear some stuff tonight. Again, if you don't get your questions answered, please email us, call us. We're all in our offices. We're all working full-time, steam ahead. In just a little over a week, we're going to see you guys. So without further ado, I'm going to turn this over to Scott Peterson. You heard his formal title. We like to call him our COVID king. So take it away, Scott.
Good evening, everybody. Thank you, Ann, and thank you, Kasha, for organizing this for us. And I appreciate all of you guys, parents and students out there attending this webinar. We do look forward, I'll echo what Ann said, we definitely look forward to seeing you guys back on campus. So my role as the Public Health Response Coordinator is to basically do just that, is to coordinate the public health response to this pandemic. and working collectively with a team of healthcare professionals, other public health professionals in the county, and even consulting with other higher ed institutions. Our role is to keep the campus safe. We can't prevent every case of COVID on campus, but we can certainly significantly reduce the numbers of disease on campus, with the public health interventions we have in place. So I know there's a lot of questions that we received ahead of time. So I'm going to share my screen here and just show you guys a few things and maybe answer a few questions for you in these slides here. And certainly at the end, we'll answer as many questions as we can. So back in the fall, when this pandemic was new, there was a lot of new data out on what we can and can't do to help keep our campus safe. And over the months, we've discovered what is safe. So most of the interventions that we had in the fall, we are going to have to keep going with in the spring. We are going to do a daily health screening. So those of you who are students, you remember the Amoka app. We had to do that daily along with taking your temperature. That was a bit of a cumbersome process. We have a new app called Campus Clear, which is significantly easier to use. And it's a daily health screening. It logs in your symptoms every day. Face coverings. I'll combine that with physical distancing. Those are probably the two best things we can do to reduce the cases of COVID on campus and in the general community. So there still will be face coverings and there still will be physical distancing on campus. And that's probably going to go straight through May, regardless of our case counts. Those two public health interventions are the most important thing we can do to keep ourselves safe and the surrounding community safe. Density reduction, and that's basically reducing numbers of people within certain rooms, reducing the number of people in certain activities. We are going to be doing that on campus. It's a state requirement. New York State Department of Health requires that we implement certain density reduction strategies in certain areas on campus. So you'll be hearing more about that from our website when we have the public health interventions updated and when you get on campus. Most of you who are students, you know what that's going to look like. Hand hygiene, certainly we know that that's not the main transmission of this disease, but it is an important factor for breaking this, what we call the chain of infection. Testing, isolation, contact tracing, and quarantine are still unfortunately going to be an everyday part of our lives here on campus. We have revamped our testing strategy, and I'll go over that shortly. Students who test positive, you will have to go into isolation. Once you do test positive, you'll be getting a phone call from the COVID office and we'll have to do what's called contact tracing. That's where we do an interview and we try to find out who you were in close contact with. And then those close contacts will have to go into what we call quarantine. The good news is for quarantine, it previously was 14 days and now New York State has knocked it down to 10 days. The CDC recommends 7 days. And testing out on the 7th day actually, but New York State hasn't adopted that yet. I wouldn't be surprised if at some point they do adopt that strategy where you're in quarantine for 7 days following an exposure to a positive case. But right now it's quarantine for 10 days. What's really important here, and I know others on this panel will talk about it shortly, is that once we return to campus, there's going to be a phased-in approach to activity. We have to do it carefully. We may start the semester with 7 to 10 days of little to no activity on campus. There will be certain areas of campus, there will be some activity, and then we gradually phase things back in. And we have to watch the number of cases of COVID on campus. That's going to be our key indicator to how quickly we can move and how quickly we can get to maybe 50% capacity in certain activities or in certain rooms. So disease count on campus is incredibly important. The one thing I want to stress the most is we can do all the testing, isolation, contact tracing, quarantine that we want. Human behavior is what's going to dictate the number of cases on campus. And I'm not certainly pointing at students. I think student behavior is important. Employee behavior is just as important. So for the students on this call, I would ask that you hold yourselves accountable and you hold your friends accountable during the semester. And certainly don't be afraid to hold employees of the college accountable as well. So these are some of the basic public health interventions that you will see and you will learn more about. We revamped our testing strategy significantly. we did last semester what's called the Upstate University's Pooled Saliva Protocol. That was a stressful process. Those of you on the call who are students who were involved in that, maybe who were in a positive pool, got the Thursday morning 6 or 7 a.m. text message and phone call from me in the COVID office saying, stay where you are, the white van is coming to pick you up and put you in the hotel until we get the final results. We understand that disrupted most of your lives for at least a 24 to 48 hour window. So we're trying to improve on that. So we decided to switch to a rapid antigen testing policy this year. But let me go over, step one here, the pre-arrival testing. And all this information is on our website. So pre-arrival testing, all students need to get tested within 5 days of arrival if you're doing the PCR test, or within 24 hours of arrival if you're doing the rapid antigen test. Some people have asked, what if we don't get our results in time? If we do the 5-day PCR, we take our test on the 5th day prior to coming, and we don't get our results yet. That's okay. There's going to be information on our website. We're not going to refuse you entry into campus. We just want to see that you got the test, that results are pending. Most of these results now are back within 3 to 4 days. So if it goes beyond 5 days, that's a bit unusual now. And then within 24 hours of the rapid antigen, most areas offer rapid antigen someplace for free or reduced costs. So we're also going to do onboard antigen testing the week of the 5th, 6th, and 7th. That's the rapid testing protocol. All residential students will go through that. You should have all gotten that information in your email. Going back one step, on the 3rd of February, if you can't find pre-arrival testing in your area, or if you're worried about the time frame, you did receive an email with this information. You can sign up for this pre-arrival testing that we're going to be offering using the previous pooled saliva protocol test from Upstate. Our weekly surveillance testing, we did get a lot of questions, pre-webinar on this. Like I said, we're going to go to the antigen testing 2 to 3 times a week. Depending on the risk category that you're in on campus, if you're a residential student, you're in one of the higher risk categories. If you live in an off-campus house with other college students, you are also in a higher risk category. So we did post all that information on the web in terms of how often you're going to be testing. The beauty of the antigen testing is that we can be flexible. We're not going to have sign up for appointments. We're going to have blocks of times. You can just show up, get your rapid test results in 15 to 30 minutes. If you can't make it on a certain day, we'll work with you and we'll get you in another day. So this reduces the stress. Like Ann Carney said in the beginning, we heard you in the surveys. So this is one of the methods we're using to sort of reduce that test anxiety on campus. No more early morning phone calls saying you have to go to the hotel while you're waiting for test results. So antigen or rapid testing is an integral part of our surveillance testing. And then we're also doing once a week what we call random or a targeted pool saliva test using the Syracuse University protocol. It's a little bit different. Results are returned much faster. The test we can actually bring right up to your residence hall. You don't have to come down to the athletic center for that. So this test is also a lot less stressful on those that have to go through the testing. And then if you want, you can certainly take a photo of this slide. All of the questions to our testing protocols can be found on the COVID-19 website at lemoyne.edu. If you're looking for a testing location, you can also find that at this coronavirushealthnewyork.gov. This is from the New York State Department of Health. Pre-asymptomatic testing is Onondaga County. You can, if you're showing up and you want to go with the 24-hour rapid test, you can sign up at this website and get a free rapid test through the county, regardless of what state or country that you live in. And then there were a lot of questions on the vaccine, the COVID vaccine, and we'll touch on those a little bit, maybe live, maybe in the chat. But if you have questions specific to the vaccine, the COVID vaccine, John Hopkins has a wonderful site on vaccine safety, as well as the CDC talks a little bit about vaccine safety. We'll have more information on the vaccine rollout. A lot of people are asking, I'm a college student, when am I going to get this vaccine? You are on the list, you will be put on the list of getting the vaccine. We just don't know when yet. We're waiting on actually getting adequate vaccine supplies. Lemoyne College would be a spot where you could get vaccinated. We have the staff here where we would do that. We would operate what's called a pod, a vaccine pod, and students could get vaccinated if that time comes and we do get vaccine. So those are the basic public health interventions that I wanted to talk about. Again, I want to emphasize behavior, both on students and on employees, our entire campus community. If we make the right decisions, we wear the face coverings, we maintain social distancing, we comply with the testing protocols, we comply with the contact tracing protocols, we'll have a safe semester, we'll get through May, we'll be able to have a graduation. So I'm looking forward to working with all of you, students and parents. The coronavirus@lemoyne.edu is probably the best way to get in touch with us. We also have a coronavirus phone number, 315-445-4600. We can get you that information, that specific phone number again at the end of the webinar. So we'll entertain questions more on the public health side of this as the webinar progresses. And now I'd like to turn it over to Mary Schad of the Student Success Center.
Thanks so much, Scott, and good evening, everyone. Thank you for being here. My name is Mary Schad. I'm our Interim Director of the Student Success Center, and I just wanted to take a few moments tonight to touch base with everyone about our academic support services for the spring semester. So I must say we were very impressed with our students this fall. We know Lemoyne students are wonderful, so any students that are on the call, thank you for everything that you did to make sure we could be on campus the entire fall semester. So despite the challenges of the fall semester and the past year, our use of student support services, so that could include our tutoring through the Student Success Center, our Quantitative Reasoning Center, and our Writing Center, in addition to working with our student success coaches, that all continued to increase in popularity amongst students, even while all those services were offered virtually. So during the spring semester, all academic support services will continue to be held virtually. As Scott mentioned, we're hoping for a phased-in approach to opening up campus. So if we do get to a point where we're able to do that, we'll work in conjunction with the COVID office so that we're hopefully able to offer some in-person tutoring or in-person meetings with our student success coaches. So during the spring semester, all of our one-on-one tutoring, our work with our peer academic coaches, any of our clinics, which are group tutoring sessions for any of our math-based courses, in addition to a reason a student might meet with a student success coach. So if they're changing their major, discussing academic standing, degree requirements, anything about the transition to college, or anything mental health wise where we can start to triage for students, that will all be held virtually. And then we can always get students to other resources on campus as needed. One thing I will mention about classes is that they will continue to be held through a variety of formats. So the way that students will learn is based on the course type. So there are 3 course types that we have currently. We have distance courses, which are where students take those courses completely online through our online learning management system, Canvas, in conjunction with Zoom. We also have hybrid courses. So that's where students might be face-to-face in class in a classroom one week, and then they might be on Zoom or working through Canvas on the next week. And then we also have our face-to-face courses where students are in the classroom with their professors. So students can find information on those courses, their courses that they're registered for, and what the format is for the courses on Finfo. So make sure students, if you're on this call, please be sure to be checking that information on Finfo, and it's located where your class schedule is. If a student does need to isolate or quarantine, students will work with the COVID office, as Scott mentioned, as well as their professors. Because of HIPAA, professors wouldn't know that a student necessarily has been diagnosed with COVID, but our campus ministry office does communicate with professors to let them know that a student might need to be out of class. Then students would work with their professors to make up that class or their work on Zoom or virtually. A question we had received earlier was about spaces for commuters and residential students. So there are spaces on campus, such as our library, James Common, and our current special events room where students can attend their online classes. They can also eat and relax. That information will be shared with our students at the beginning of the semester as well, just like it was in the fall. So students can have a full list of the areas where they're able to utilize them publicly on campus. And then finally, just to mention that if a student does need any type of extra support, please send them to the Student Success Center and our office in the library. So we're staffed daily in person during the spring semester, so we'll rotate through the office. Well, we can't meet with our students in our actual offices. We schedule virtual meetings. We can still have socially distant conversations and make sure that we are supporting your students or any students here with us in any way that we can. Our phone and email are always checked, and we're also to be happy to be a starting point for students. So if you're not sure where to go or who the contact person is, please feel free to always get in touch with us, and we will be able to connect you with the appropriate folks. I will now turn it over to my colleague, Mark Godleski, our Assistant Dean for Student Development.
Thanks, Mary. Good evening, everyone. Mark Godleski, Assistant Dean for Student Development, and happy to be here tonight, talk with you for a few minutes about our Dolphins Declaration and moving forward here in the spring semester. But before I get to that, and Mary talked a little bit about this in her remarks, just what a wonderful job we all did to get through the fall semester. And I know that there were a couple of videos that went out at the end of the semester, a couple of other messages that were emailed to our community. But that was a huge accomplishment, especially when there were so many other schools in the New York State area, across the country, that either had to press pause or send students home early, including a school about 10 minutes from Lemoyne College campus. So a lot of success, and I think it really does talk about the Lemoyne College community and our students and everything that you did, everything that you sacrificed to allow us to get through the entire semester in person. And I know that we can do that for the spring semester as well. There's going to continue to be some sacrifices, as Scott mentioned, but as a community, we will be able to do it and get through it together. So tonight, just to talk about a couple of things, just a review of the fall semester, and then to finish off with the Dolphins Declaration. You know, with the fall semester, so I talked about that success that we had, and you know, certainly as my job as Assistant Dean for Student Development, my primary responsibility is to oversee the conduct program on campus. And so there were a couple of hiccups during the fall semester, but for the most part, there was wonderful compliance by all of our students, and students were wearing their face masks. They were adhering to our visitation policy, to our no parties and gatherings policy, keeping the social distance around campus in the dining center. And so some wonderful accomplishments, and we're going to need students to continue to do that as we start off the semester. The Dolphins Declaration is online on our COVID-19 webpage. It'll also be posted around campus, so students, especially those that are living in the residence halls, you'll see them in the lobby of your buildings and spread out in the campus center and so forth. And we're really looking for you to continue to do those things that you did so well during the fall semester. For those students that are returning, we're not going to ask you to go over the COVID-19 modules again, the online training that you did during the fall semester. If you're a new student this spring semester, you will be assigned the training modules via Canvas, and you'll be getting that information within the next several days. You know, I think the big thing that we heard was the visitation from the fall semester, and we certainly understand the challenges that policy presented. So to start off the first week here, 7 to 10 days, as Scott mentioned, it'll be a phase-in approach. And so we'll get you on campus, we'll get you tested, and we are looking to create those bubbles, especially within our residence hall areas. And then based on the numbers, we feel confident that we're going to be able to ease up on that visitation policy a little bit and allow students to be able to visit within their residence hall area, within their residence hall building. And so there'll be more information, weekly communication that comes out from student development, campus life and leadership regarding that particular policy. But we ask that you stay patient, and as we continue to get those numbers and develop things, we will certainly keep the community informed. So just a lot of success to build on here from the fall semester. We're really excited about some of the programming initiatives that we have in store for the spring semester. And before we hear from John Haley, I want to just pass it on to Ann Bersani, and she can give us a couple of updates on housing. So Ann?
Yes, Ann Bersani here. I'm the Associate Director for Campus Life and Leadership at Le Moyne. And for students out there, you know me as the person who sends probably one too many emails about housing. So our goal is always to stay in contact and communication with you to give you the best information that we can. And sometimes that results in a few emails. So the most recent set of emails that I sent out, and I say set because there was more than one, was about coming back to campus for the spring semester. We'll be opening for students on February 4th for RAs. So our RAs are coming back on February 4th with a specific window of time to come back to campus. And then other students will be coming in on the 5th, 6th, and 7th, pretty evenly distributed on all those days. So those of you who have been emailing, asking about switching times, stuff like that, I do have a little bit of flexibility with that. So if you have a time that absolutely does not work for you, please send me an email. I am happy to make those accommodations. I know that things are kind of wild and everything changes. So I'm happy to help you and make those accommodations for any of those days. Unfortunately, we can't get you in before the 5th, but there is flexibility on the 5th, 6th, and 7th. The opening schedule is that you'll come into campus directly to the event center. It's kind of different than it has been in the past, but similar to how it was in the fall semester. So you'll come into the athletic center, we'll collect some information from you, we'll take a look at your ID, we'll turn your ID card on for your residence hall. That's how you'll know that you're done with the check-in process. But before that happens, you'll participate in that rapid testing that Scott was talking about a little bit earlier. So we want you to come into the athletic center, just you. If you do have a helper, if you need a helper to help you get your stuff back into your room, that's fine. They just can't come into the athletic center with you. They will be able to go in and help you get your stuff in and then head back out of the residence hall pretty quickly, as long as they're following all of our public health precautions, like wearing a mask and hand hygiene, keeping a distance from other people. So it is kind of a one-stop shop. That's what we tried to set up. The really, really, really important part, and it sounds so silly, is right now, if you're a student, check your bag, check your wallet, make sure you have your ID card. That ID card is going to be so important. If you don't have it, no big deal. We can print you a new one in a matter of seconds. Just email us at campuslife@lemoyne.edu. Say, I lost my ID card. Can you please print me a new one? Then when you come to check in at the event center, we'll have it right there for you, so you won't have to worry about it. So those are the hot topics, I suppose, about moving back to campus. I can't tell you enough about how much we miss you. This is not lip service, guys. It's real. And we're really excited to have you back on campus, and hoping that when you're back on campus, we can do things right and stay as safe as we can, so that we can continue for the entire semester, just like we did last time. Usually, food and housing go hand in hand. So I'm going to pass it off to my friend, Jim Soriano. There he is.
My name is Jim Soriano. I'm a director of dining and obviously can't run Zoom, which is probably a good thing because we make the food. So dining, similar to how it was in the fall, we will start, as Scott mentioned, we'll start with a phased-in approach. So week 1, we will require that all students take all their meals to go. And that is just so we can try to set the good bubble on campus and keep everyone safe. After that point, as long as that first week goes all right, we will open up dining to 25% occupancy, tables of 1, 2, 3, and 4 persons. And also we'll open up the special events room in the James Commons for additional seating. So we should have plenty of seats for everyone who wants to eat in the dining room or right nearby. So that'll be, we did get a question about dividers or plexiglass at the tables, and that is not, we will not have that, but there will be the option to sort of sit at the table by yourself or with your roommate if that makes you more comfortable. And then again, as was mentioned, as we go through this semester, we'll open up more and more seating as we continue to do that or to continue to be safe. The Dolphin Den, just a quick hit on the Dolphin Den. Right now, New York State regulations require that we close the den at 10 o'clock. If that changes or when that changes, we will change those hours back to normal. But that is, for right now, the den will close at 10. But we do have something new to add to that area. We do have a new app that students will be able to sign up for that will link with your campus card, which will allow you to order through the app. So for easier access, or so that you don't have to wait at the den. We hope to offer a delivery service as well from that as we move into the semester. And then just a few reminders about the app. We still will require the app to be shown as you enter the dining hall or order in person. And also face coverings will be required anytime you're standing or seated and done eating. So just those things will still be in place in the dining center. So again, sorry for the confusion with my muting, and I'll turn over to John Haley with Campus Life.
Jim, it's Kasha, and I'm sorry to interrupt, but there's one question that came in through the chat about the, is there any update using reusable containers instead of styrofoam for the takeout options?
We will have some, we will have the green containers available. Right now, we don't have enough to hand them out to everybody, but we will have them for people that would like to do that. We will have that option available for students when they come back.
Great, thanks, Jim.
You're welcome.
Thanks, Jim. So I just want to welcome everybody and let you know, like everyone else, I'm very excited to get the students back on campus, get them together doing things, enjoying their experience here outside of the classroom. That's really what we kind of focus on in campus life. So we did have, I thought, some great successes last fall doing some of the programming and kind of changing the way we did things and to try and get more students involved in the activities and keep everybody safe. I think we learned a lot last year from that. I know that my programming board and other students on campus are already working on ways to incorporate some of what we've learned into the programming and things that we offer for the spring. So I'm pretty excited, looking forward to getting us all together and getting some of these things done. So as you heard earlier, we're really gonna take that first week or two to just get students settled, make sure that we kind of know what the infection rate and stuff is. And but even though we're here and we may be kind of in a slow roll that first week out, we're still going to be doing some programming, some virtual stuff, a lot of stuff outside. So we do have some plans for that. And then once hopefully things open up a little bit more, we have a lot of people interested in doing a lot of activities for the students. So my LSPB board, which is our main program board on campus, they do plan on doing mostly in-person events. They're just going to be smaller, offered more often for students, some virtual, some hybrid, where we'll do a in-person event and we will share that virtually for students who can't be at the event to enjoy. And we are doing some things like our late night LaCasse, where a couple nights we're open up the caf late for students to come over and just kind of take a study break, maybe have a little bit of entertainment there, and to just kind of get them out and moving around and seeing some other people. So looking forward to that. Our RAs, you did hear that we're going to hopefully change our visitation a little bit, not in the beginning there, but once things settle down, we're hoping that we will be able to allow a little bit more visitation within the buildings for students. And the RAs this year, they will be focusing on wellness, well-being for our students, and focusing on building community. We heard about students feeling isolated, feeling lonely. That's not what we're about for sure. That's something that we want to take care of. So that's going to be their focus for the spring, is making sure students know that what's going on. We kind of get them involved and make sure we are checking in on them. So a little change in focus with the RA programming, definitely building community and making sure your students know what's happening. Our SGA and our clubs are very well funded for the spring semester. SGA was very generous with them to make sure they had whatever funds they needed to do the events that they wanted and that they have planned. So I think we're going to see a lot of activities from our student clubs. We want to make sure that if you're in a club, you keep in touch with your executive board, let them know that you're there, that you're involved, you want to help out. They'll be in touch with you. They do have, as I said, the funding to do it, and we do believe we'll be able to do more in-person programming this semester than we did early on in the fall semester. So looking forward to that. SGA is pretty psyched about it. They've got some great ideas planned. So our intramurals, we're planning on that being a little bit more to offer this semester than we did in the fall. We are going to have intramurals, and it'll be phased in as you heard earlier on from Scott. We're going to start with some of the things that we think are a little bit more safe, and then as things open up, we'll try to add some of the intramurals that we weren't able to do in the fall. We will have our weight room, our cardio room open. We will have our yoga studio open to do certain types of wellness classes down there. We are in the process of putting in an ice rink behind the athletic center that will be for the kind of a seasonal ice rink, and we'll be doing having some open skate times for that. Hopefully bring broomball to campus, make that maybe have hot chocolate and things going on down there. So as you may have heard Ann say earlier, bring some nice mittens, bring a nice hat. We'll probably be making some of those and branding some of those for LSPB and giving those things out for students who are here, because we want you to come out. We're going to spend a lot of time outside this February and March. So make you sturdy and maybe do some things you've never done before. So we're going to have sledding. We're going to have snowshoeing. Just a lot of outdoor activities. We will be doing some trips with small groups to places like Highland Forest for sled rides and cross-country skiing and that. So whatever outdoor activities we can do in the winter here in Syracuse, you're going to see us offering those through SGA and intramurals and that, and our student programming board. We also have our Friday, Saturday shuttle going to Walmart, Marshall's Plaza, where there's a lot of places to grab something to eat, some shopping if you want to get things done. Wegmans, we're doing, like I said, doing that on Friday and Saturday. We've got extra shuttles so we can keep students socially distanced, and as long as you wear your mask and you just show your ID, we can get you off campus for some of those times when you need to get things done. So in campus ministry, I know they've been pretty active in making sure they're going to be doing their services and offering other opportunities for fellowship. We've given that, they've got some extra funding to do that, as well as C-STEP has stepped up, and they're going to be offering some outdoor activities for students as well. So a lot of people invested in trying to make sure there are activities for students this spring semester, especially trying to figure out what we can do in the winter, with February, March being as long as it is sometimes here in Syracuse. Looking forward to some of our more traditional activities in April once the weather clears up and getting students out. We're looking for a real strong finish. So a lot of great stuff. Looking forward to having you here. A lot of creative ideas. I think you're going to enjoy yourselves. If you're not sure what's going on, I always tell students, make sure you check your email, because SGA, LSPB, that's where they send the information, let you know what's happening on campus and how to get involved. So just looking real forward to it. And like Ann said, it's been a long couple months without you, and it's going to be great having you all back. So with that, I'm just going to turn it over to Ann, I believe. She's moderating it. I don't think there's anybody else after me that needs to go. So is that correct, Ann?
Yeah, I think so. So I think Kasha was going to moderate the live questions. I know we've answered quite a few in the chat, but I'm going to turn it back over to Kasha, and then we can field any questions.
Sure, thank you. And we did have a number of questions come in through the Q&A, and they, I think, just about all were answered. There is one regarding food service for Jim Seriano. So Jim, if you wouldn't mind coming back on, the question was about there was reports of some food shortage and maybe not as many options as there traditionally are. So just wondering if that's been addressed for this semester.
It has been addressed for the semester. We've revamped all the menus, going through them now again, just to ensure that we're offering a good variety of food and trying to keep things fresh. We do have some special events planned to address that as well. As John mentioned, we'll be doing the late night snack option again a couple of nights a week after that first week, we hope. So yeah, we believe that anything like that has been addressed.
Great, thanks, Jim. And maybe to the healthcare team, Scott, Jen, Kathy, I see a number of questions are coming through about these new variant viruses and the concern about that. So Scott, maybe you could just respond so everybody can hear the answer to that.
Yeah, and certainly Jennifer Teeben, our physician assistant, can chime in as well. But I think right now the initial reports say that it might be more transmissible. So we need to still watch the research, follow the research through the CDC, but it's not conclusive yet exactly how much more transmissible these new variants are. So just to answer, there were a few questions on our public health interventions. Regardless of the variant, our public health interventions will not change. Face coverings, physical distancing will actually take care of that variant the same way it would the normal variant or the normal strain that's here. So same public health interventions. Jen, do you want to add anything to that?
No, I was just going to give the same information that any virus is transmitted the same way for this type of respiratory virus. So as long as we're keeping up with the face mask, the hand washing, and the social distancing, a UK variant versus, well, which one of the other variants as well. We just work with the Onondaga County Health Department if we see any variants on campus. So we will pay attention to all of the information that is coming through.
Scott, and I think you mentioned before about where students' families can learn more about the vaccine if people are concerned about the safety of that. I think you referred them to the CDC website or Johns Hopkins, is that correct?
Yeah, so certainly look at the CDC's vaccine page. You can look at Johns Hopkins University. They've got a really nice vaccine page. But I would also encourage you to reach out to your personal physicians, your healthcare providers, and ask them about vaccine safety. Or your pharmacy. That's probably the best place for you to get that information at.
Great, thank you, Scott. Someone asked too about the recorded version of this webinar. It is being recorded. We will post it to the COVID information page as well as the parent page, and we will email it out to everybody who has registered for this. So it will be available, and we'll also share Scott's slides as well.
Asha, somebody had a question about the weight room and stuff, so I just said I would answer it live. The hours were 6 a.m. to 4 p.m. Last semester. We are looking to see if that really had to do with the air exchange in the building, and we think that we can get those hours extended for the spring. We just need to get some verification from the people who do that certification. So yeah, we do know that people want more hours in the weight room. We're hoping to add some in the evening once we get that certification.
Great, thanks everybody. I'm not seeing many other questions. It seems most are answered. If anybody does have questions, we'll give it another minute to if they want to pop in through the Q&A, or if you just want to even throw it in chat, if that's easier, we can grab them now and answer them live.
Hey, Kasha, I can touch
Sure.
on a few things. We saw some themes in some of the questions that were submitted previously. Several of you have asked about, I have one of the vaccine, I have both vaccines. I've got either the Pfizer or the Moderna, I got both shots. Do I still need to go through the surveillance testing? Do I still need to quarantine? And the answer is yes, all the public health interventions still apply. So the vaccines aren't a 100% guarantee that you will not get the virus. So you still need to go through all the public health interventions, and that does include the testing protocol. Some folks were asking about testing positive. So there were several questions on positive tests, whether it be in December or January. If you did test positive for the COVID virus, still submit those results in either your email or on our webpage. There's a Google Doc where you can submit those results. You're exempt from testing for 90 days from your date of positive. So please make sure you upload those your positive results to the webpage, and someone from the COVID team or the wellness team will reach out to you to discuss exactly when you would resume testing after that 90-day window.
Great. Thanks, Scott. If there's no other questions, I think we can wrap up, which coming in under an hour is wonderful. So thank you to all of our panelists. Let me just wanted to say, that wraps things up for the evening. So thanks to Anne, Kathy, Anne, Mary, Mark, John, Scott, and Jen. We appreciate them being with us tonight and working so hard to make sure that our community stays safe. Stefan, thanks for putting up that last slide there for more information. I wanted to thank our participants for tuning in. Again, this webinar is recorded and a link will be on the COVID information page as well as the parent web page, and we will email it out to everybody along with the slides that Scott shared. So on behalf of Lemoyne College and the Office of Alumni and Parent Engagement, I'd like to extend our gratitude once again to our presenters and to those who participated. And we hope you have a great night. Stay safe, be well, and we look forward very much so to having our students back on campus. Thanks, everyone.